Good afternoon. I am going to present my paper on proportion of dry eye disease and its impact on quality of life among postmenopausal women attending ophthalmology outpatient department of a tertiary care center in Alappuzha. Dry eye disease is a multifactorial ocular surface disease which causes symptoms of ocular pain, discomfort, and decreased visual acuity. And it has a significant effect on the quality of life of the patients and is more prevalent in females. Objective of my study is to find the proportion of dry eye disease and its impact on the quality of life among postmenopausal women attending the ophthalmology outpatient department of a tertiary care center in Alappuzha. It is a hospital-based cross-sectional study and among the postmenopausal women attending OPD of the ophthalmology department. Methods of the study include 98 postmenopausal women as per the inclusion and exclusion criteria were asked to fill the ocular surface disease index questionnaire, which was composed of 12 items referring to activities in the week prior to the completion. And the dry eye evaluation is done using Schrimmer 1 test, tear film breakup time, fluorescein staining, and by Oxford grading using fluorescein and Ross Bengal stains. This is the OSDI questionnaire in Malayalam used in my study. This is the scale used for grading the severity of dry eye after calculating the score, which is the sum of the scores of all questions answered divided by number of questions into 25. This is the filled OSDI questionnaire. This is a dry spot detected in T-bud and this is Ross Bengal staining. Inclusion criteria includes postmenopausal women 51 to 80 years with dry eye features like burning sensation, foreign body sensation, photophobia, blurring of vision, itching, ocular fatigue, sticky tears and watery eyes. Exclusion criteria includes history of autoimmune disease and other systemic disease like diabetes and asthma, history of laser treatment, ocular trauma, ocular surgery and contact lens usage, use of systemic and topical medications, hormonal replacement therapy at present and during the past 1 year, post-hysterectomy, suspected carcinoma breast, carcinoma endometrium, hormone-dependent neoplasia, and those patients who are not willing to participate in the study. Results from my study include mean age of the study population was found to be 63.2 plus or minus 6.9, and the mean age of menopause was found to be 49.9 plus or minus 1.3. And the mean postmenopausal period duration, that is a present difference between the present age of the patient and the menopausal age, it is found to be 13.4 plus or minus 7. And by Schrimmer test, proportion of dry eye was found to be 67.3, and by T-bud test it is 68.4%, and by Oxford grading it is 68.4%, and by Oxford grading 60.2% had minimal dry eye and 8.2% had mild dry eye. And using OSDI questionnaire, 65.3% of the study population with dry eye had severe impact on their quality of life, and 14.3% had moderate impact and 2% had mild impact. Based on the percentage distribution of presenting symptoms, gritty eyes was found to be the most frequent symptom of 78.57%, followed by blurred vision, painful eyes, poor vision, and sensitivity to light. Coming to the association of dry eye and quality of life, from my study, those patients with dry eye detected by Schrimmer test, 92.4% had severe deterioration in the quality of life, and those detected by T-bud, 89.6% had severe deterioration, and by Oxford grading, 89.6% had severe deterioration. And association of postmenopausal period with the quality of life, those with postmenopausal period less than or equal to 10-year group, 58.5% had severe deterioration in quality of life, and in those with more than 10-year group, 70.2% had severe deterioration. Coming to the discussion, in this study, we evaluated the proportion of dry eye disease in postmenopausal women and how it affects their quality of life. And from our study, proportion of dry eye was found by Schrimmer test to be 67.3%, by T-bud test 68.4%, by Oxford grading 68.4%, and with minimal dry eye 60.2% and mild dry eye 8.2%. Based on OSDI score, 92.4% were severely affected by dry eye by Schrimmer test, 89.6 were severely affected by based on T-bud, and 89.6 by Oxford grading. From our study, those persons without dry eye by Schrimmer test, 9.4% had severe deterioration quality of life, and by T-bud test among persons without dry eye, 12.9% had severe deterioration quality of life, and by Oxford grading, in those without dry eye, 12.9% had severe deterioration quality of life. This could be explained by the fact that there could be subjective errors in filling the questionnaire, there could be an influence of other environmental factors which produce dry eye, and there could be subclinical autoimmune disease which was not detected in my study. From our study, gritty eyes was found to be the most frequent symptom, followed by blurred vision, painful eyes, poor vision, and sensitivity to light. And though coming to the postmenopausal period, more than 10 years, 70.2 had severe deterioration quality of life, and less than or equal to 10 years, 58.5% had severe deterioration. Limitation of my study is small sample size and detailed history of autoimmune diseases are not taken, and other dry eye evaluation tests are not done, and other environmental factors are not taken into consideration. Relevance of the study: dry eye is prevalent in postmenopausal women and lead to severe deterioration in quality of life, and alteration of sex hormones lead to abnormal tear film, which in turn lead to increased symptoms of dry eye. Therefore, a combined approach need to be considered between the gynecologist and ophthalmologist for the management of this disorder.
Thank you. Good presentation. I just wanted to ask you, of all the tests which you've done, which is the most reliable for diagnosing dry eye?
Shrimmer.
Sharma. And the Oxford grading, you said what percentage had a mild disease?
By Oxford grading, mild dry is 8.2 percentage. Minimal is 60.2.
Minimal is 60.2. But what percentage of your patients actually reported a severe deterioration in
Quality of life.
quality of life?
Based on OSDI score, 92.4 by Schrimmer test and 89.6 by TBIT and 89.6 by Oxford grading.
So why do you think there is a discrepancy here? You know, when you're measuring, you know, it's
Subject.
yeah.
Subjective.
Why do you think that is so?
Because Rose Bengal staining and fluorescein staining, those patients, some patients it is Rose Bengal staining has taken more.
Okay.